This is breaking news from the Las Vegas Review-Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.
To remain nimble through challenging times, and we've highlighted our agility as an exchange, especially throughout the trying times of the pandemic. To recap some of our efforts over the past year, we were able to offer an extended special enrollment period thanks to the American Rescue Plan Act, also known as ARPA, which came into law in March and passed by the Biden administration. Through ARPA, we were able to offer expanded subsidies and empower more Nevadans to enroll in health insurance plans. At the end of ARPA's open enrollment, we concluded in August of this year, we had 17,094 Nevadans who took advantage of health insurance savings, and the exchange increased the number of total enrollments by 7.6%. I'd like to thank our special guests here today who've been champions for the exchange and supported its mission in helping Nevadans to access affordable insurance. Thank you, Governor Sisolak, for being here today. Your support as governor has made a significant impact on our efforts to get more Nevadans insured. Your leadership has helped the exchange grow and make a positive change in the lives of tens of thousands of Nevadans. We also have Senate Majority Leader Nicole Cannizzaro, Assemblywoman Rochelle Wynn, and Senator Fabian Doniate joining us all this morning. I appreciate you all being here to discuss the importance of healthcare in the state of Nevada. I also want to thank the members of the media. You've helped us tell stories and inform Nevadans on how to become insured, and we really appreciate it. We will be opening the floor to the media to ask questions at the end. After that Q&A, we will be delivering remarks in Spanish as well as a Spanish Q&A. Now I'd like to turn it over to Governor Sisolak.
There we go. I got it, I think. Thank you, Heather, and the entire Nevada HealthLink team for having me here this morning with you on this exciting day for all of us. Today, it is my pleasure to share how Nevada is making great strides to provide Nevadans with more affordable options for health insurance and bridging the gap between the uninsured. This open enrollment period will be another testament to our dedication to reducing the number of uninsured Nevadans. I'm also grateful to the other elected leaders from the state legislature who are joining us today to call attention to the importance of expanding access to insurance through Nevada HealthLink. Majority Leader Cannizzaro, Assemblywoman Wynn, Senator Nate, thank you for your leadership and for adding your voices to this important conversation. As governor of the great state of Nevada, I'm proud of the steps our state has taken towards ensuring Nevadans have access to quality and affordable healthcare coverage. I want to commend Nevada HealthLink for increasing the number of enrollments in health plans significantly this year. The pandemic has highlighted the importance of access to affordable healthcare. The American Rescue Plan Act allowed Nevada HealthLink to offer an additional special enrollment period that took place earlier this year, which was extended several times, giving Nevadans more time to enroll in health insurance that fit their needs and the needs of their families. Thanks to the American Rescue Plan Act, special enrollment period, over 88,000 Nevadans are now enrolled in comprehensive coverage through Nevada HealthLink, a growth of over 13% since 2020. I'm committed to keep these enrollment numbers rising and lowering the uninsured rate. Additionally, I support keeping costs down so that healthcare remains affordable and attainable for all Nevadans, no matter their job status, their income, or their class. Thanks to the American Rescue Plan, Nevada HealthLink is being able to offer more support to Nevada families by being the only place where individuals can find federal tax credits that help lower monthly premium costs on their plans. This makes it easier for Nevadans to find quality coverage that fits within their budget and health needs. And most people, nearly 90%, will qualify for financial assistance on Nevada HealthLink, including Nevadans making over 400% of the federal poverty level. Even those who currently have a plan through Nevada HealthLink could see a much lower monthly premium cost, and people who may have earned too much to get financial help in the past are now eligible for the first time. For Nevadans, this means more money back in their pockets for essential needs, while still having the peace of mind that comes with having comprehensive health insurance. The open enrollment period is the best time and one of the only times to explore and shop plans throughout Nevada HealthLink. Even Nevadans who are already insured with a plan through Nevada HealthLink should consider looking at the new plan options. Nevadans might find there are new plans offered that even better suit their needs. Every eligible Nevadan should be covered by health insurance to protect their health and to avoid financial ruin in case of emergency health situations. This includes healthy Nevadans too. Just because you're healthy does not mean you do not need health insurance. If you wait until you need it, it is already too late. We are still fighting this pandemic. Comprehensive coverage through Nevada HealthLink can protect Nevadans from devastating financial consequences. Now is the time for Nevadans to take action and get themselves insured through Nevada HealthLink. I'm committed to increasing the number of insured Nevadans and am also committed to getting more Nevadans vaccinated for COVID-19. The vaccine is free, regardless of whether or not you are insured. And it is urgent that we make sure Nevadans have both healthcare coverage and the COVID vaccine. Thank you, and I'll hand it back to you, Heather.
Thank you, Governor Sisolak. Thanks for being here today. With that, I'd like to offer the microphone to Senate Majority Leader Cannizzaro, who can offer her remarks.
Great, and good morning. Thank you so much, Director Krabulik. I want to thank you and your team at the Exchange, and of course our Governor Sisolak, for leading the charge on really helping to get Nevadans insured and to expand healthcare access here in the Silver State. Of course, ensuring that every Nevadan is covered by quality health insurance and dental insurance that is affordable has to be a top priority for all of our elected officials and has to remain a top priority for us as we work to ensure that at all levels, we're providing affordable health care for all Nevadans. We have, of course, as a state, made an important amount of progress in this work since the implementation of the Affordable Care Act. We've helped tens of thousands of families enroll in coverage that meets their needs. Our uninsured rate as a result has fallen more than 20% from a decade ago, and now is at 11% here in Nevada. The enhanced subsidies that we've talked about this morning and the special enrollment period provided by the American Rescue Plan Act helped an additional 17,000 Nevadans get covered. I am, of course, proud to have worked with Governor Sisolak and my colleagues in the Nevada legislature to make such important changes in our healthcare coverage and affordability here in Nevada to benefit patients. For example, we've protected them from surprise billing. We have gone to expand access for mental health services through mobile mental health units, and we've increased transparency in prescription drug pricing. All of these actions have helped us to ensure that we are showing that we're dedicated to expanding health coverage for Nevadans. But we still, of course, have a long way to go. We have over 350,000 Nevadans who are currently uninsured, and Nevada HealthLink is now the go-to option with this special enrollment period and open enrollment period to get insured while we still maintain quality health options at affordable prices. So that's how come this open enrollment period is so important. And starting today, I would encourage everyone, if you are looking for health insurance, to go to take action and get enrolled on NevadaHealthLink.com. Regardless of where you live or your circumstances, it is likely that there's a plan that's going to work for you that's offered through the Nevada HealthLink. And of course, there are 126 different plans from 7 health insurance carriers to choose from. So lots of options for you to go there and check it out. Using Nevada HealthLink to compare those insurance plans and get enrolled is the only way that to access those federal subsidies that we've been talking about that can help make coverage affordable for you. Almost 90% of Nevadans will qualify for financial assistance through the Exchange. And so I can't stress how much it is so important for us to go to NevadaHealthLink.com and get enrolled if you are currently uninsured. I encourage everyone who's looking to get insured to take advantage of this open enrollment period. And it starts today. So get on there at NevadaHealthLink.com and get enrolled. I, of course, would now like to welcome my friend and Nevada Assemblywoman Rochelle Wynn from Assembly District 10. I keep wanting to put you in a Senate District, Assemblywoman. Assembly District 10 to share some remarks.
Thank you, Senator Cannizzaro. Today is an incredibly important day, and I am honored to be here to encourage Nevadans who need health insurance to go to nevadahealthlink.com and find out how they can access affordable healthcare and dental insurance options that meet their needs. To echo Governor Sisolak's remarks, nevadahealthlink.com is the only place where Nevadans can access federal subsidies that make insurance affordable to any family or individual who wants to make sure their family has peace of mind that insurance provides. As the chair of the Assembly Health and Human Services Committee, we regularly hear from Nevadans across the state about the importance of having access to affordable health care. Regardless of where you live, Nevada HealthLink is the easiest way to access the most affordable health insurance for Nevadans currently seeking coverage. I also want to remind Nevadans that the Nevada HealthLink provides free assistance to help answer questions about the different plans available. I encourage Nevadans to take advantage of the free resources provided by the Nevada HealthLink. You can visit their website, or you can even call their hotline to get free help. You can even meet with an assister in person at various community events around the state. Assistance is available in multiple languages and is completely free. I know personally for my family that understanding healthcare in your native language is imperative to understanding your own health and being able to advocate for your own health options and health treatments. I'm grateful for the partnerships that the Nevada HealthLink have developed with our community and business groups throughout the state, because I think it only helps access to healthcare better in our state. It's particularly important that our communities of color take this opportunity to learn more about their options and get covered. As a state, we still face persistent disparities in our insured rates within our communities of color. For example, 22% of Hispanics remain uninsured compared to only 9% of white Nevadans. We can and must close this gap. Nevada HealthLink is the most convenient way to access the quality, affordable care that help keep every Nevadan healthy. It's also critical that Nevadans living in rural communities take advantage of the open enrollment period. Nevada HealthLink has expanded its number of carriers and number of plans, giving more plans and options to the rural communities to shop. NevadaHealthLink.com guarantees that you can trust that your insurance will be there when you need it. Every plan provided by the Nevada HealthLink provides the 10 essential health benefits, including pregnancy and maternity care, prescription drug coverage, and mental health and substance abuse disorder services. Finally, the pandemic has exacerbated the challenges our community face with mental health and substance abuse. Getting coverage through the Nevada HealthLink can help Nevadans who are struggling with these challenges to get the support they need. Now is the time for Nevadans to get covered, and the Nevada HealthLink is the best place to access quality, affordable insurance that every Nevadan deserves. At this time, it is my pleasure to turn over this presentation to my friend and healthcare champion, Senator Fabian Donante.
Thank you so much, Assemblywoman, and of course to Heather and the team today at Nevada HealthLink for the opportunity to join you for this press conference and to advocate on something that I'm really passionate about, and that's access to affordable healthcare. Today, I am here to urge all Nevadans to get covered and also to promote the awareness of Nevada HealthLink and, of course, of the open enrollment period that will definitely go ahead and help out our much needed Spanish-speaking communities. In COVID-19, throughout these last few months, we have seen time and time again that communities of color are often those that are most impacted. We face an unsurmountable amount of barriers due to systemic disparities that have been eradicated for many, many years and perhaps even decades. And of course, we know that communities of color are also the ones that are often most uninsured. And in order to fix these barriers to affordable and good healthcare, we want Nevadans to know that they have the resources available, such as we mentioned today, the federal financial assistance that will help to significantly lower monthly premiums. And throughout open enrollment period, we will see definitely a lot of efforts from Nevada HealthLink helping engage our community. And so ensuring that those who need these resources are able to access their health insurance options. For me, that's a very important factor because, as I mentioned, throughout the session and of course at different events. When I was a young teenager, my dad was diagnosed with type 2 diabetes, And that's the reason why I got into public health, because I had to be the one that had to translate between my father and his medical provider. If my parents did not have the health insurance that they did, I definitely do not feel that my dad would have received the adequate care that he needed to help overcome his type 2 diabetes. And still to this day, the costs of insulin and his prescriptions are definitely something that we need to take account to. And if we have the opportunity to help engage folks in our community to receive access to care, that can make a difference between life or death. And the first step to doing that is, of course, through this open enrollment period. Nevada HealthLink does a lot of work with the Latino community, and most particularly, especially for those who are undocumented, we have to remember that regardless of your immigration status, Nevada HealthLink can help you in the right direction. For example, at this moment in time, if you are a parent and you are undocumented, or if your kids are born in the United States and you currently reside in the state of Nevada, your kids can still qualify for health insurance through NevadaHealthLink.com. And also on top of that, if you want to speak to someone in Spanish, please know that Nevada HealthLink offers certified insurance brokers and navigators who conveniently are located throughout the state. And particularly, we have a lot of resources at the Boulevard Mall or the Metals Mall that can help translate and speak to you in your native language, and of course in other languages that ensures the translation of information. You can find the nearest free assistance by visiting NevadaHealthLink.com. So again, tonight, as we're talking about open enrollment period, while you're at your dinner table with your loved ones, make sure you have a conversation about your health insurance and the problems that you go through, and then make an appointment to visit an enrollment assistor near you. And now I'd like to hand it back to Heather.
Thank you, everybody. That was wonderful. I really appreciate all of your support. And before we get to questions, I wanted to just run through a couple of important things that make this open enrollment period different from the past few years, and so that we can ensure all Nevadans have access to quality and affordable health care. The open enrollment period started today at midnight at 12 a.m. I know I was up, I was looking and making sure it was all working according to plan. So for those of you who enroll in plans between November 1st and December 31st, your coverage will start on January 1st of 2022. Anyone who enrolls between January 1st and the 15th will have a coverage start date of February 1st. It's critical for uninsured Nevadans to take advantage of this open enrollment period, because unless an individual experiences a qualifying life event, like moving to a new area or having a child, the open enrollment period is the only time Nevadans can enroll in insurance through NevadaHealthLink.com. The passing of the American Rescue Plan has been significant for Nevadans and allows Nevadans to continue to receive increased subsidies when they enroll through Nevada HealthLink. Even though the rates have gone up by about 4% since last year, so have the subsidies, which means that many Nevadans will have $0 plans and will experience very minimal changes to their rates. Thanks in part to ARPA, or the American Rescue Plan Act, 90% of Nevadans qualify for financial assistance, making it even more affordable. In fact, NevadaHealthLink.com is the only place consumers can access that federal financial assistance. We're really excited this year to offer plans from 2 additional insurance carriers, bringing it to a total of 7 different insurance carriers. Plans are available, of course, in every county throughout the state. Insurance carriers include Health Plan of Nevada, Silver Summit, Anthem HMO of Nevada, Select Health, Friday Health Plans, and the 2 new ones, Aetna and Hometown Health Plans. We also have increased the total number of plans available from 50 to a record-breaking 126 different plans. And we have 20 different dental plans available through 6 different dental carriers. In addition to providing more subsidies and more plans, Nevada HealthLink wants to make sure that enrolling in coverage is as easy as possible. We have a useful tool that we encourage Nevadans to use who are looking to enroll in health plans. And this tool is available at NevadaHealthLink.com and allows you to connect to our Certified Enrollment Assistant program. It's a free service which allows you to connect either by phone or in person with an enrollment expert that will help you through the enrollment process, will help you compare plans, will discuss the rates, and will find the best option for your budget and health plan needs. This this help is available through the Find Assistance button on NevadaHealthLink.com. As our speakers referenced, help is offered in multiple languages in order to serve a diverse population across the state. We are dedicated to serving our diverse populations, and when the federal government cut funding to our Navigator program, we've continued to invest and make significant investments in the diversity of our Navigator programs. We have over 600 free professionals that are available to help get enrolled, so don't delay, go connect to Find Assistance today. Health plans, a couple more things that health plans offered through Nevada HealthLink are ideal for Nevadans who don't qualify for Medicare or who are not accessing Medicaid benefits, and those who don't have employer-sponsored health insurance, such as independent contractors and gig workers. It's important for those who are currently receiving Medicaid. We are aware that Medicaid will begin redetermining eligibility in the very near future. And due to that important fact, we need to make sure that people who are currently on Medicaid throughout the state ensure that the Medicaid agency has your most up-to-date email and phone number and contact information so they can reach out to you when they begin to redetermine Medicaid eligibility. With that, we'd like to open it to questions. And so if you have a question, please feel free to enter it into the chat and then, or raise your hand and go ahead. And Connie, I think you're going to take the MC from here.
Correct. Yes, it looks like we have one question already. So I will unmute Paul to ask his question. All right, Paul, I think we can hear you now.
Okay. Yeah, my first question is for Governor Sisolak. What kind of things do you hear from Nevadans just about the challenges of getting health insurance? And then also when you see that 350,000 uninsured number, how disappointing is it that there are so many uninsured in Nevada when there are options available?
Well, I think it's a matter of education and getting the word out. And I commend Heather and her entire team for doing what they can to get the word out. There are options that are available for everyone if they just pursue that and they get on the website and look around. No one should go without health insurance. And I think that the pandemic has brought that to light, that it's a necessary thing for everyone to have. And I would encourage everyone to go online, see what's available. As I said previously, even if you were online before, if you applied before, it's changed. You might be eligible for assistance now, or there might be a plan that better fits your needs. So you need to be updated and go online and take a look at what's available. And hopefully we can make some impact into that couple 100,000.
Thank you.
Thanks, Governor. Does anyone else have any questions? Please use the raise hand feature or enter. Oh, we have one in the chat feature. Connie, do you want to read that?
Yeah, I was going to say, we just got one in the chat from Rick Anderson. Senator Doñate mentioned Navigator services at Boulevard Meadows Mall. Could you expand on that? What services are available, hours, etc.?
Sure, I can expand on that. We have two of our broker grantees and Navigator entities that are in the Boulevard Mall and the Meadows Mall. And it is, those guys are open extended hours. You can check on NevadaHealthLink.com/find assistance to find more information about their hours and their phone numbers. We recommend you make an appointment, but you're obviously welcome to stop in and they'd be happy to see you during at least normal business hours. And I know they have extended hours during open enrollment. Oh, and Janelle shared that information. Thank you. Anybody else have any questions? It looks like Paul has another question, Connie.
Yes, I was going to say.
Yeah, thanks. This one's for you, Heather. Just talking about the number of options people have now. Just a few years ago, there were some rural counties that were at risk of not having any options at all. And now you guys have all these carriers. I think you said 7 total now, 126 plans. So what does that tell you just about the success that Nevada has had over the past few years of growing?
Well, thanks for setting me up with a great question, Paul. I love that. I'm immensely proud of the work that we've done to go from 2017, when it looked like we were going to have bare counties and some of our counties without any health insurers, to having multiple carriers available, hundreds of plans. It's been a lot of work. And what that tells me is not only is there a real need, Nevadans need qualified, affordable, comprehensive insurance. And we've got a good market. The insurance companies want to be in Nevada. They see the potential and they want to be a part of this space. And so between the continued stability around the Affordable Care Act, the work that the Exchange and the Division of Insurance have done to make sure that we stabilize the Nevada marketplace, and then the American Rescue Plan Act, we've just seen wonderful progress in health insurance.
Paul, do you have another question?
Nope, that's all I've got.
Great. In the chat, McKenna Ross asked, if a Medicaid user loses eligibility after redetermination, will that loss of insurance count as a qualifying event to enroll within Nevada Health Link?
That's a wonderful, perfect, queued up question. Thank you so much. So yes, potentially. So if someone loses their Medicaid eligibility once Medicaid starts to redetermine, they could potentially be eligible for Nevada Health Link, and we are working closely with the governor's staff, with Medicaid and the Division of Welfare and Supportive Services to make sure that we catch those people. But the loss of your minimum essential coverage or your insurance does qualify you for a special enrollment period on the exchange.
Wonderful. Rick Anderson asked, are there any common myths you hear from people who are hesitant to seek coverage through Nevada Health Link, and how do you counter those?
That's a great question too, thank you. The biggest, most common misconception we hear from folks is that they can't afford it and that they're unable to afford insurance. And so we spend a lot of time building relationships with community organizations and navigator entities and doing a lot of outreach, trying to make sure that people understand that there is financial assistance available to them, and that there are people who can help you navigate for free to the plans that are right for your individual needs and for your budgetary needs. With 90% of our enrollment or enrollees being covered with financial assistance, I think that that's a pretty moot point at this juncture. Many people are finding that they're qualified for way more subsidy or financial assistance than they ever dreamt was possible. And so again, we encourage people to go and check it out. Don't just write it off, go take a look at the savings that are available. I think we'll just do one last call for any further questions. You can enter it in the chat or raise your hand. Okay. With that, then we will let our panelists go, and we'll stay on with Senator Doñate, who will be offering comments in Spanish. Thank you, Governor and Senator Canizaro and Assemblywoman Nguyen. We really appreciate your support.
You've been watching breaking news from the Las Vegas Review-Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.